The purpose of the session is just to walk through the guidance that we recently released for the COVID protection framework that comes into effect 11:59 on tonight, and address any of the grey areas that may still exist. We will be sticking to sport and junior surf. That's my remit, and as I say, Gary can address some of the medical questions, or just give a brief overview of COVID as an infectious disease. Yeah, so we won't be delving too much into areas outside of sport and junior surf. If you haven't had a chance, check out the guidelines. They're on our website. The link is in the chat. You'll note that this clearly says draft, and it will be updated. Sport New Zealand put out their sort of first draft on Monday, and they've since updated it yesterday. And so one of the purposes of these online sessions as well is to see the common themes and questions that come through in terms of the pinch points, so that we can provide a bit more detail for clubs and how they can operate in this space. And I'd just like to acknowledge and thank all the regional sport managers and club development officers who have helped develop this information, and not just about tonight, but it's really been the last 4 months of working within COVID, transitioning through the alert levels and now into the COVID protection framework, as they've both supported Surf Lifesaving New Zealand in their role, but also the clubs in terms of the delivery of events and junior surf. Some regions have been really lucky and been able to have the full menu of events so far this season. Other regions haven't had any, and we're now moving into a phase where we've got some regions who may have been in level 2 and are now stepping into orange or red, and so that's going to change the dynamics and logistics. And really the outcome of this is to provide, hopefully, clubs and members the confidence in order that they're going to be able to deliver their activities appropriately. But we're all learning. It's a big change and it's come on really quick. I know there are events and junior surf activities this weekend, so it's not going to be perfect first time round. And yeah, just a reminder, as you join the chat, if you can just mute your microphones and that sort of thing, would be greatly appreciated. Now, moving on, I will just share my screen, which is always risky. So I just want to show people here at the top this little function. You can put your hand up if you'd like to ask a question at any stage. Put that hand up, and we'll get to that as soon as we can. And again, if you have questions, please type them in the chat, and we'll work through them one by one. Obviously, if there's some common questions, we'll try and address them all at once. So that's our lovely Surf Lifesaving Sport Facebook page. So this is our web page. Just want to make sure people are aware, and we have a page dedicated to COVID-19 updates. We have a frequently asked questions section at the top there. That's just being sort of refined, as we've literally got hundreds of questions, and we're just trying to group them into easily accessible bits to reduce the need for people to scroll through mountains of text. And as you scroll down here, you'll get down to all areas of surf lifesaving, and then sport and junior surf in the COVID protection framework. And also there's a link to the Sport New Zealand guidelines and resources as well. So this was the memo that was distributed to clubs on yesterday, and is sort of the basis of our guidelines going forward. As I say, it is a first draft, and it may change, as I'm sure all of you are aware. The COVID information has changed on a regular basis, so it's important that we keep up with that. All the information will be uploaded onto our website on that page I just showed you, as well as communicated to clubs via our operations circular and our sport Facebook page as well. And I think it's also important to note that all the information we don't just make up. It's really about synthesising the information that comes out of the government and Sport New Zealand to try and make it applicable to the surf lifesaving context. And so hopefully people have had the opportunity to read this information. If they haven't, that's okay. We will walk through it, but not all of it. So fundamentally, I guess delivering sport and junior surf is very similar across the red, orange and green settings within the COVID protection framework. The key difference is really just being around the restrictions of the number of people who can be part of any activity in one place at any given time, and the restriction on the number of people is also dependent on whether that activity requires proof of vaccination or not. So in order to adapt to this, activities may need to be modified or restricted to comply with those guidelines. General information hasn't changed in terms of dealing with the risks of COVID. So the real basics of, if you've got cold or flu symptoms, stay at home and get a test. You'll hear later on from Surf Lifesaving New Zealand's Medical Director, Dr. Gary Panda, and he'll reinforce some of these key things around wearing masks, getting vaccinated, and operating in ventilated spaces, and doing as many activities as possible outside, as well as our general hygiene practices of washing our hands and keeping our distance and disinfecting shared surfaces. The first thing that we're going to touch on is just around vaccinations. So obviously, many or hopefully all of you are aware that Surf Lifesaving New Zealand, using the government health order mandated vaccinations for all paid and volunteer lifeguards, as you'll see there. And I think a lot of the questions or queries in the sport and junior surf space is, what about all these other people that don't fit within the mandate? Coaches, junior surf instructors, parents. Given that we've mandated vaccinations for example, beach educators, as they're working with children in the education setting, we strongly recommend that those working with young children in our clubs are also vaccinated. However, we don't have the ability to, supported by a health order, to mandate that for our entire membership. Just some definitions or clarity on some things. So as you'll see in a lot of the information coming out, reference to My Vaccine Pass, or MVP. So this is the record of your vaccination status. And this is, if you are double vaccinated, your ability to download that information onto a device or print it out. And then there is also another app, the Ministry of Health Verifier, that can be used to effectively scan the My Vaccine Passes to verify someone's vaccination status. This is different to the Tracer app. That's what you use to scan in at a location to keep track of where you've been. In terms of vaccinations at events and gatherings, the first draft of the COVID protection framework that came out, there was quite a difference between events and gatherings. In orange and red, it said events weren't permitted. Since then, there's been some changes, and effectively the difference between events and gatherings is very little. They both have the same restrictions in terms of number limits. So just some key information about that is that organisers of events and gatherings, so if we're talking junior surf, The organizer would be the club. Or if we're talking about, say, a regional surf lifesaving event, Central Region Junior Championships, the organizer will be Surf Lifesaving New Zealand. So it's up to the organizer of that activity to work with the venue or the facility owner to determine whether proof of vaccination is required. And so where this might impact surf lifesaving clubs is if they use a pool to train in, both in and off season, and that pool may require proof of vaccination. So as a club or a club member, you don't have a choice, and surf lifesaving has no influence over the decision of that venue. Events and gatherings organised and managed by Surf Lifesaving will require proof of vaccination from all eligible people. So that means things like oceans, regional, junior and senior carnivals will require proof of vaccination. And as it says there, as the organiser or venue, individual clubs determine if their activities require proof of vaccination or not. And we've seen over the last few weeks from clubs, a number of clubs have already indicated where they're going in that space. Just moving on, I'm not going to go through it word by word, but I think we have had some more definition around this. I think that surf lifesaving really evenly straddles the definitions of gatherings and events, given that we're in public spaces and used for recreation, and some of our events are ticketed and people do pay fees, but on the flip side, we're in a public space. It's very hard to control, so we very much straddle those definitions. I think the key thing for clubs to understand is the number of people you can have is dependent on what colour you're in and whether or not you're asking for proof of vaccination. And as you'll see there in our colours, if you're asking for proof of vaccination, at the moment the country is either in orange or red, so you have the choice there to be unlimited. If you're not asking for vaccination proof, then you're limited to 50, and obviously in red it's 125. A key thing to understand is you can have multiple gatherings at one venue. However, each gathering has to be separated, and separated means by at least 2 meters. So in a junior surf context, that might be different age groups being separated, spaced out along the beach to allow you to do that. Now, it's probably unlikely that clubs would have more than 100 kids in a particular age group and that sort of thing, but I know some clubs also run their junior surf programs with combined age groups or as a whole collective. The limits include everyone, so that includes children under 12 in a defined space. So if you're trying to figure out your numbers, it includes everyone within that space except for workers. And so a worker is defined as any person who is carrying out work in any capacity for that business or service, whether that's paid or voluntary. So if we look at the context in which perhaps we operate some scenarios, so a Sunday junior surf session, the people who are delivering or working in any capacity are effectively the coaches, the managers, and the water safety. And so they're excluded from the limit. So you could have, if you are in say orange, and you had a group of 40 kids, those coaches would be excluded from the number. The people included in that number are obviously the participants, the kids, but the parents and spectators, and it's important to understand it's in that defined space, and we'll get to that in a bit more detail soon. Very much the same for coaching sessions. Where the difference is in a competition or carnival environment, obviously the coaches and the managers aren't directly delivering or working for that event as such, so they would then be included in the limits in that space. Whereas the excluded people would be those who are delivering the event. Now, I've got a few scenarios here that's on the paper, and I'm going to leave people to read that information for themselves. It's available on our website and has been distributed. So what I will do is I'll stop sharing my screen for one, and I will get to some of the questions in the chat, and I'll also just address some of the common questions that have come up over the last few weeks from clubs or from our staff who clubs have asked through. So one of the big questions is who has to be vaccinated in the junior surf or sport context. And I did address this before, but I just wanted to run through it again, is that yes, we have mandates for certain parts of our membership, and they can only apply to that part of the membership. So in the sport or junior surf setting, there's no mandate, but there's just context. And as I said, if we apply the same logic from an education setting, we're strongly encouraging people involved in delivering or supporting the activities of junior surf to be vaccinated. Then it depends on the size of the gathering. Obviously, if you're determining you're going to have no proof of vaccination, there are increased restrictions in smaller groups. And as I said, the venue can also impose proof of vaccination as well. Ultimately, there are very few settings people can be involved in the sport or junior surf without needing to be vaccinated. Whilst clubs themselves may be thinking, oh, this suits our needs, if they then go to turn up, as I used the example before, say to the Eastern Region Juniors, that event will require proof of vaccination for those who are eligible. So it's just important to understand those differences. One of the big areas of that kind of sits in the grey is that the rookies. So obviously rookies are old enough to be eligible to be vaccinated, yet they're not lifeguards, and so they're not mandated to be vaccinated. Yet as part of their training, they may take part in patrol activities and that sort of thing. And so we'll be providing clarity on this out to the membership tomorrow. But in effect, that advice will be that if part of rookie training requires someone to be on patrol in an operational sense, and if being part of patrol and operational requires vaccinations, then that will apply to rookies. This doesn't mean that people, if people are unvaccinated, they can't be rookies. They just can't take part in those particular activities. Yeah, events versus gatherings we'll get to. I think one of the big questions in the junior space is, what about under 12s? How does it work? Can we have a gathering of vaccinated and unvaccinated at the same time, as long as they're separated, or can we have a group of one group that's unvaccinated followed by a group that is operating under a vaccination pass? In terms of consecutive, one after the other, yes, you can run a vaccinated group and an unvaccinated group, as long as there's time and space between the two to ensure that if they're using that same space, let's say it was maybe not this context, but it could be an indoor exam or lifeguard exam or something like that, that can occur, but it just needs to time so there's no interaction, and as well as giving time for cleaning and changeover of things. In say the under 12 junior surf space, there is the potential to have a vaccinated group and an unvaccinated group. If you're on a big beach, you've got lots of space, you could space out people 500 meters from each other at the same time. We have sought further clarity from Sport New Zealand on this, because it isn't very clear. If we were to take a different sport like a touch rugby, where there might be 6 fields on an open park space, it's about, and they're 2 meters apart, each being its own defined space. There is the potential for say one group to be working under a vaccine pass and another in a non-vaccinated space, and we're just trying to get real clarity for our context for that. At the moment, our advice to clubs is it's an all or none thing. You're either doing all under a vaccination proof of vaccination status or all not. In terms of, in terms of the number limits for under 12, so even though kids under 12 are not eligible to be vaccinated, they still count towards your total numbers. So if your total numbers, if you're in orange and your total numbers and you're not running vaccine passes, they are part of that group of 50. So it's just understanding those numbers. In terms of proof of vaccination and how we're trying to work it, so we've taken a step-by-step approach. Our paid lifeguards and those other volunteer roles that are under the mandates, we're required by law to collect specific information, and so my vaccine pass by itself isn't enough to satisfy those legal requirements. And currently the process is that individual members have been sending that information to Surf Lifesaving New Zealand, and where effectively the vaccination status is built into our our PAM database, and acts a little bit like a refresher or a 200-meter badge, where there's effectively a tick box. We receive the information and verify it, and then we tick that box next to their membership information. And so what we are, again, trying to get a bit better at is what's required for those people not covered under the mandate. And so a coach who's not a lifeguard, or a junior surf coach who's not a lifeguard, a surf official who's not a lifeguard or a patrol support, what information do we require from them? We know clubs are also trying to help support their members by collecting this information on their behalf to give to Surf Lifesaving New Zealand. We are also making sure that because these are medical records, that we are not in breach of any Privacy Act information in terms of who has access to that information and that sort of thing. Ultimately, we want to make it as easy as possible for clubs to operate, so that they can know in advance within their groups who is and who isn't vaccinated, to try and reduce the likelihood or potential of conflict, say at a junior surf session where you have to ask people to scan in. It's likely that scanning in processes will be required for the first few weeks in a face-to-face setting, as our technology and as our record keeping kind of keeps up with the demand. Another really big topic that no doubt there'll be some questions in the chat about is, how do we control the public? We run our sessions on the beach. It's very hard to control access on and off the beach in certain settings, or just people walking their dog or whatever it may be. In terms of your responsibility of running an activity, a gathering, a group of a coaching session, say, as the organizer, that being the club, they have to have a clear system and take all practical steps in relation to, one, the QR codes, so making sure that the location QR codes where people can scan in to say that they've been there, and also a process for checking the My Vaccine passes. And things include, obviously, pre-communication, sending out information to to your club members about what a junior surf or a coaching session is going to look like. There's been some really good examples in level 3 in the northern region and level 2 elsewhere around with maps and showing people where they can go and that kind of thing. Clear signage, barriers, ropes, fences. I know these become logistical and financial things. And as I say, the more preemptive communication on how your activity is going to look, the better. Along with controlling the public is what do we do about parents? Are parents part of it? Are they not part of it? How far away do they have to be? And that sort of thing. And our advice is understanding or focus on the gathering and the purpose of the gathering that you're putting together. So if you've got kids coming for a junior surf session, the advice or encouragement to clubs is really separate those parents. If you've got a grass bank or if you've got lots of beach to work with, just say, hey parents, if you guys stay here, the kids are going to be here, and that allows you to really focus on that group. And that means if you're implementing vaccine passes, you only have to focus on the adults or the people over the age of 12 in terms of getting their vaccination status or not. Right, so that's a whistle-stop tour of some of the real key points, and I know looking at the chat, there's lots of questions as well, and so what I'll do is I'll work through these question by question. If you also want further clarity, please just use the function at the top of your screen, a little face with a hand, and you can put up your hand and we'll address that as well. So housekeeping, yeah. First, I'll leave Simon's points till last, and I'll get to question from Julie. What information should under 13, 14 send to be loaded to the CRM for carnival entries? Right, so hopefully I addressed this before. So at the moment, we're just trying to seek clarity because this group isn't covered under the mandate. So we don't necessarily need all the details, but we're just trying to find out whether or not a My Vaccine Pass will be okay. Will they just show these on the beach as they enter arenas? So at the moment, we're playing catch up with our technology. And so, for instance, if there's a junior event this weekend, the entries might have closed 1 or 2 weeks ago, and so there hasn't been the opportunity to align vaccination status on our entry system. And so it will be for the first few weeks an on the beach scenario. I know there's a junior event, I think it's in the southern region, maybe Dunedin, and they're working on a scan and get a wristband type scenario, a little bit like a concert, to allow. So that means they're controlling their defined space, which will be roped off, and they know who's in it, and they know the people inside that would have shown verification, as an example. Can we as junior surf coordinators record if someone has a My Vaccine Pass so we don't have to ask for it every week? Or is this a breach of medical privacy? So the Verifier app doesn't record any information from a My Vaccine Pass. It just says whether they are or not. I wouldn't see if the person freely gives you that information. It would make it certainly more efficient for you to run your, if it's, say, the nominated coach or manager, to avoid them. Only it's a 5-second 5-second task, but to avoid them doing that may make your junior surf Sundays a bit more efficient or effective on the day. Question from Andrea: will the Internow system be updated so that only those with uploaded vaccine info can be entered? Yes. So yeah, as I say, our technology is catching up, but effectively it will work like a 200-meter badge or a refresher. If someone goes to enter into an event, a little red flag will pop up and say, this person cannot enter this event or this particular race or discipline because they don't hold the required qualifications, with a little ellipses to say vaccination or 200-meter badge, or both sort of things. So yes, that is happening right now. Just to confirm, as long as parents have been advised to be away from the area that the children are being instructed, then there is no need for them to show proof of being vaccinated. Yeah, so this is all about the defined space of your gathering. So if you're saying under 10 kids are over here, meet by the flag, and it might have a little coned area, it might be a clear space. Again, it depends on your context with which you're operating, and if your communication to parents is, this is our defined space, if you're in this defined space and we are requiring proof of vaccination, you'll need to scan in. Otherwise, your area is over there. Let's say you've got a grass bank or something like that. Go and grab a coffee, sit down and have a chat. And so you're saying you've organised this gathering. You haven't organised this gathering of parents or the thing over there. They're a function to get the kids there, but they're not participants or part of your gathering. If we take that to a bigger environment, say a carnival, that's when if we're in a multi-arena thing and we've got people moving all over the place, that's when an event organizer will have a system to count parents, one as the number, or spectators, and they will need to be verified. So I hope that makes sense. Again, if I haven't answered a question clearly enough, please put your hand up and we can circle back around. If we can collect information about vaccine passes without scanning, this is tricky because of the expiry dates. So I guess we need to collect expiry dates too with permission. Yes, so that is a very good point, and I guess one of the reasons why it's certainly easier for us to do it technologically, but as I say, we're trying to catch up for individual clubs to keep a spreadsheet of people may actually incur more administration than just a, let's say, age group manager, if that's how you run it, scanning in the people on the day. I'd say scanning on the day is probably a lot quicker and easier. And I think it's also a good look if your club or if your gathering is activity is saying we're going to be vaccine, we're going to need proof of vaccination, showing having people do that, I think will kind of be a nice visual cue for people to understand that you are doing as that you said you would do. Callum, if you don't have an area cordoned off and don't do wristbands, how do people know who is unvaccinated at your event? They can stand up and join the event. Yeah, so again, this is one of the challenges around, I guess, running a sport or a community activity in a public space, in terms of managing that space and that sort of thing. So I guess in terms of doing things differently, our advice is take steps to cordon off an area. Sorry, I just went out of view. Take steps to cordon off an area to define your space. There's not an expectation that someone walks the beach with their Verify app on their phone and tries to scan literally every person and their dog. So it's really important that you can control the controllables, and what you can control is your gathering and your defined space or spaces, and so creating mechanisms to do that is important. And yeah, it's tough without wristbands and that kind of thing. We face a much tougher environment, say indoor basketball, who have a door and can put someone at the door and just check people in. So we're challenged in a different way, and so that means we have to adapt and to do things differently. The most important question for nippers is, can the sausage sizzle run if it's outside and not in the club? This is a tricky one because it falls within the provision of food, whilst not quite in a hospitality setting. And so if I can just keep a note of that and get clarification, because I don't want to give incorrect advice by saying it's outside, it's great, because it does come into the food provision of food space that isn't my expertise as yet. So I will highlight that to find out further information. And just a point on that, if there are questions here that I can't give 100% clarity on, all of these questions are going to be bundled into our frequently asked questions that's going to appear on our website, and we will be putting back out updated guidance to, as I say, to really clarify some of those grey areas that are shown through these sessions. So we're not just going to forget about them after this. What involvement can unvaccinated club members and parents have around the club? Again, starts to go outside the remit of sport and junior surf. Ultimately, it's about the clubs do have a responsibility to try and be as inclusive as possible to their members, vaccinated or unvaccinated. Some clubs have already taken the step to say our club, our venue, or activities are vaccination only. That's that club's choice. Where clubs are trying to balance the two, again, they have to take steps to understand that if you're in a group and of 50, of 100, and one person is unvaccinated, then it is effectively that whole group is unvaccinated. And so therefore you're straight away confined by the limits and that sort of thing. And so there can be involvement of unvaccinated people in particular roles, or if they're going to maybe be only doing those maybe in isolation or away from others, or when the people aren't there, or when vaccination activities are taking place. And yes, Callum, yeah, the key is you really do need to define a space as best you can. Question from Danny. Can you recommend how everyone arrives at a junior surf Sunday session? Great suggestion on keeping parents separate, but as everyone arrives, it's usually a bit messy. The parents, kids all mixed up, hard to separate on arrival. We might have about 130 people all up at Brighton. Yep. Good question. And I think one of the things is my next steps after this is to try and create a platform, an opportunity for other clubs to share what they do or have been doing. I think this weekend is going to be a big learning curve or next few weeks for a lot of clubs. And so there's no point in 74 clubs trying to solve the same issues by themselves, is trying to collaborate and working with their CDOs and regional sport managers to try and do that. What I can say is that where I have seen it work, say in Northern region, who have been under the strictest kind of restrictions until Friday, is that pre-communication is key. Sending out information to your members to identify meeting spots, drop-off spots where the groups are going to meet. I know some clubs like to do everyone arrive in group and do the big welcome and information share and that kind of thing. So it's potentially about having to rethink how that works and say, well, can we do this slightly differently? I know some clubs that have in excess of 400 and 500 junior members that have been running them in separate groups of 25 spread out along the beach, and just had to rotate their time. So instead of doing it all in one block, it means they've got, under 8s at 8 a.m, under 9s at 9 a.m, 10 a.m, 11 a.m. So it's a big commitment to change it that way, because it takes all day, so to speak. But it's about reimagining what junior surf looks like to, as one suggestion, Danny, to manage that kind of arrival, because agree, it does kind of conflict with trying to do things correctly if everyone's going to arrive, 130 people arrive at the same time. Question from Andy. Sorry, you may have clarified this, but if a group of under 12s are not yet eligible for vaccination, but otherwise the club is scanning my vaccine passes, does the fact that under 12s aren't vaccinated mean the vaccine pass makes apply, or non-vaccination pass maximum numbers? Okay, I'll just try and reread that. So, Andy, what I'll do is I'll get you to, if you can hear me, do you want to just chuck your mic on and try and provide a bit more context to that?
Yeah, sure, Lewis. Can you hear me all right?
Yep.
Yeah, so the question was, so I was just trying to get my head around the fact that, so you're scanning passes, right? You're scanning vaccination passes, but
yes,
when you've got a whole big group of kids that aren't vaccinated, you said before that if one person isn't vaccinated, right, the non-vaccination criteria apply, when you showed those criteria earlier,
yes,
about max numbers.
Mm-hmm.
So, but when you've got a group of under 12s, they aren't vaccinated because they can't be vaccinated. Which rule applies?
Okay, cool. So thank you. No, good question, and yeah, that clarifies it for me. So under 12s, for the purposes of gatherings, are considered vaccinated. Okay, that makes it nice and easy because
that's great, mate. That's cool. Yeah,
they're ineligible, so it effectively means they're vaccinated. So thank you. I've been thinking. This is from Tricia. I've been thinking what we could specify times of arrival from different age groups or by surname. Yes, so some clubs have been staggering times, splitting groups up by surname. And if I could give a personal account of this, coincidentally, I have two daughters and they do surf. They started it before I started working in it, so it is coincidental. So their club is a large club, and they've had to split them up. And there's my youngest daughter is in the under 10s category, and there's about 45 girls in that. And we're in Auckland, level 3, step 2, so restricted to groups of 25. So what they've done is they've split those kids into two groups by alphabetical, and they have 20 kids in each, and they've got two coaches and 3 water help, which means they stick to their ratios in the water, and they stick to their limits of 25. And an observation from me is that the coach to kid ratio is 2 to 20, so effectively 1 to 10. If they were in a group together, there would be 40 kids, and whilst there might be 4 coaches, generally, 1, maybe 2 people kind of lead an activity, and so the coach ratio would be 1 to 40. And so certainly the smaller groups have increased the engagement and the activity time because there's less kids, less lines, shorter lines in these smaller groups. So it's also been an opportunity for some clubs to reimagine how they deliver in that space, and really took a whole lot of boxes in and around why kids get involved in certain activities. So sorry for that little personal aside there. Please, from Joanne, please clarify what happens with water safety when the children are in the water. They are quite close to the children and unlikely to be 2 meters away. Less than 1 meter is preferable. How does it work? So, yeah, well, in this situation, Joanne, I would assume you're referring to the fact that the water safety or the adults would be unvaccinated, and so you're running an unvaccinated session, so you'd have smaller numbers. The unfortunate reality is, if you choose to do that, then there's very little you can do in relation to the proximity to the kids in terms of being 2 meters or more away. And when I say that, that's related to a whole separate defined space. These people are part of your gathering, and so they are the risks in terms of running unvaccinated gatherings, is that you'll have potentially unvaccinated adults close proximity to unvaccinated kids. Options do include wearing a mask. It may seem silly in a water scenario, so there's practicalities about that, but that would be the possibly the only other risk mitigant you could put in place, other than it being vaccinated. Comment from Danny here. Could you cordon off an area around the club? Then also you have cordoned off an area on the beach. Okay, that's one comment. Another question from Naomi. Am I correct that mask wearing is not mandatory, but at Orange it is strongly recommended at Nippers? You'll hear from our medical director very shortly, but in effect, mask wearing is strongly recommended all the time, in particular indoors, but also when you're in close proximity to people. It's one of the probably one of the key risk mitigants. Does SiteDocs link up with the scanning app to show total number, if not names? What information would be best to record in SiteDocs? Oh, that's a good question, but outside of my remit, we haven't quite managed. SiteDocs is something we're working with. Obviously, the Verify app is a government Ministry of Health app, so we haven't quite, got that advanced yet. So sorry, I'll note that down to try and find more information about. Oh, okay. I've been talking for 50 minutes straight, and I know it's a lot of information to take in because I re-listened to the session from last night, listened to myself talk for an hour or so. So I just want to, I'll take an opportunity to have a break, and I'll ask our medical director, Dr. Gary Panda, to jump on and say a few words in relation to just around clarifying some of the medical risks and that kind of thing, and then I'll get to a few other questions later on. Thanks, Gary.
Yeah, anytime, Lewis. I could listen to you talk all night. Ah, the dulcet tones. This is my second go around in 2 nights, so I think I'm starting to memorize your presentation as well as my own. So my name is Gary Panda. I'm the medical director for Surf Life Saving New Zealand. Some of you may not even know that there is one, but I am it. I'm an emergency doctor in Whangarei ED, and I work on the Westpac rescue helicopter as a doctor aboard that. And I'm on the New Zealand Resource Council and some other things. I have an interest in this COVID stuff, and I just wanted to share, 5 minutes worth of my perspectives and thoughts on how to think of risk when you've got little kids that are participating, or even not so little kids. So I've got 2 kids that are now teens, but I understand the concept of what it's like to be worrying about whether your kids are going to get COVID and whether they're going to bring them home to the grandparents and that sort of thing. So just to back up a bit, our approach at Surf Life Saving New Zealand has been to really push 3 concepts: mask, vax, and ventilation. Probably I should start, since we're talking about nippers and that sort of thing, by saying that your risk outdoors is almost trivial. I'll never say zero, never be absolute, but with anything in medicine. But as far as is practical, when you're outdoors in a well-ventilated area, your risk is about as low as it gets. The opposite of that is when your kids decide to go indoors for an education session, or just to have drinks and snacks and food. And when you have a group of people breathing the same air in a poorly ventilated indoor venue, densely crowded, where people are talking, which puts out an enormous amount of aerosol, that's about as bad as you can get for the spread of COVID. And so while I don't think you need to worry virtually at all, so I'll just speak for myself. If I was a parent, I'd have essentially no worry about what goes on out on the beach in open air, or we're talking about when someone is either performing a rescue on a patient or they're teaching a student and they're very close. Those risks are not zero. I'm not going to be that I'm not going to overstate it that way, but it's as close to zero as we can practically get. But once you're indoors in a social situation, especially when the masks come down to chat, to eat and drink, that's where the risk is. So if you want to know where the super spreader events happen, they're in bars, nightclubs, restaurants, church choirs, because people are singing in close proximity to others for hours. And those are your high risk places. You know, the lifeguard tower at my surf club, densely packed area. If it's a bit chilly, it'll be all closed up. Several people up there rebreathing the same air. That's what you want to avoid. So to keep your kids safe, don't worry too much about the outdoor setting, but transfer more of your worry to the indoor setting. And so if you got kids that are old enough to wear masks, do it. The mask keeps the vaccine in the person who is breathing and prevents you from getting it in. So it's a win-win. When two parties have the mask on, it's good for everyone. And I want to be clear that young people, up to 40% of people under age 20, will have COVID and not manifest any symptoms. So if you're an 18-year-old lifeguard or educator, you may feel perfectly fine and not even know you are infectious, and yet have the infection within you and be transmitting it to others around you. So masks are our way of decreasing the amount we're exposed to. And as I say, it's keeping it within the person who's infected and away from us. And so double masking with both parties masked is incredibly good, wise, and effective, even in the face of like Omicron, any new variant. You go back to first principles. Another one of your first principles that will never fail you is just this idea of ventilation. Being in the outdoor setting whenever possible. If you have a class you're running, you do it outside. You have a patient interaction, you do it outside. You are hanging out, you do it outside. If you have to be inside, fine. You'll be masked up, you'll have doors and windows open, you'll have great ventilation, and you won't be in there for prolonged times. That's how you avoid COVID. And then lastly, vaccination. We went with vaccination for all lifeguards because for the simple reason that I don't think you can pretend to be looking after the safety and well-being of others, of patients, and quote, rescuing them, if you're not willing to decrease the risk to those patients. And we know that vaccination decreases your risk of hospitalization by 90%, your risk of death by 90%, and your risk of transmitting virus to others by probably in the realm of 40 to 60%. There is tons of misinformation on this, and so you just have to be real careful. But I think surf ultimately did the right thing, and I'm quite proud of the fact that they take their life-saving part of their name seriously enough to prevent as much unnecessary infections as they can. Someone mentioned about masks in water, not recommended when wet. Not just does it lose its electrostatic charge, but it also waterlogs the fibers. And a wet mask is probably of no benefit to you, and is probably a harm to you or a risk to you in terms of swimming and breathing efficacy. So don't worry about masks in the water. Once again, that's not our area of focus. We're concerned about prolonged indoor close contact in poorly ventilated indoor spaces. That is where we get the risk. Interesting study I'll share with you. It was done on healthcare workers, and it found that it serotyped the infections that they were getting and found that they were not infected by their patients. So people like me, I work in an emergency department around a lot of sick people. I am not as likely to get COVID from my patients as I am from my friends and family, because I have prolonged indoor close contact with them. And that is really where your risk is. And so the more you can wear your masks, the safer you will be. Those masks should not be single ply fabric masks. They should be 2 or 3 ply. The ones that Surf Life Saving New Zealand put out are fine and adequate. Surgical masks, like the blue ones with the little elastic ear bands, the blue ones that you sort of like, surgeon's masks, those are more effective. And sure, if you want to wear those, great. They can even be reused. But the point is, the mask you wear is more effective than the one you don't. So there's no point in having an elite mask if you leave it off. Get something that's comfortable. Like, for example, for just walking around stores and whatnot, I've got a cloth mask that's super comfortable. I like the way it looks, happy to wear it. Great. Could I get 30-40% more efficacy out of a surgical mask? Yeah. But I don't think it's a big deal either way. The point is to wear the mask. And I think that takes us to everything I wanted to talk about here. I'm happy to take questions on anything really of a medical nature. So if you want to put it in the chat, put it in the chat. If you want to ask me, ask me. And other than that, that's probably it for me. So I'll give you like maybe 30 to 60 seconds to either raise your hand or speak up and let me know if you've got something you'd like me to address. Go for it. All right, Lewis, I guess they want to hear you talk again. So I hope you've rested your vocal cords and you're ready to go for another. It's what, 50 minutes, right? That was the halfway mark of the talk. Is that right? As the intermission?
Yeah, absolutely. Absolutely. A couple of questions have popped up in the chat.
Oh, good.
Further to
I'll
Gary's.
go to them. Oh.
Yeah, starts with Andy.
I don't know. There's so many. There's like, yeah, there's so many comments. Maybe that's from the other day. Why don't you just read them out for all of us? So
Yeah.
I can hear 'em. Go for it.
Further to Gary's points, a couple of quick queries re clubhouse practice. Are clubs generally mandating a requirement for mask wearing by all, including guards, when indoors? And secondly, with scanning in, are clubs requiring individuals to scan their My Vaccine Pass just once a day or every time they enter the clubhouse or gathering during the day? Thinking people who enter the clubhouse multiple times a day.
So I can take the first bit. You can answer the second one because I don't really know much about policy and protocol for you guys. More of medical advice. Mask policy is, there's an advisory sheet that was put out by me and my group, and it's available through Surf Life Saving on the website. It's face mask advice, and it goes back to when we had levels, and it talks about where masks are required under what levels, like 3 and 4, and where they're strongly recommended and where they're recommended. So have a read of that for SLS&Z's version of their policy. Also keep in mind that your clubs are their own entities in many ways and can set their own policies in many ways, not in every way, but in many ways. And so you do have clubs that are making rules. Everyone will be vaxxed who sets foot in the surf club, etc. So you talk that through and decide that for your own club. In terms of advice, I can recommend that when you're, once again, indoors, have a mask on. Now, maybe things will change in time, but now's not the time to become complacent with this. With Auckland sort of letting loose, there will be a significant spread of cases all around the country. You see things popping up here and there. We're still a naive country in terms of not having faced it, so we will get pockets and surges. And don't, when you hear these fools talking about like freedom days and things, don't get that wrong. Like don't get the misperception that we are somehow getting through this thing. There's wave after wave after wave that's going to be coming, and being kind of slick, getting your club dialed in to do the right thing and be smart and to not be paranoid, but to do the right and most effective things is important. Like, I'll give you an example. You could spend all the time you want in the world deep cleaning and stuff, but if you don't understand the concept that this is an aerosol disease going through the air through typically close, prolonged indoor contact, then you could waste tons of time, quote, deep cleaning things, which is really just a form of hygiene theater, not something that actually works. Now, that's not to say that cleaning high touch areas isn't a good thing. Sure, clean the doorknobs, clean the surfaces, wash your hands before eating and before touching your face. But you need to know where the risk is and try to mitigate it. So I hope that answers your question. If I were at that club, I'd be wearing a mask. My kids would wear a mask, and I would encourage the club to have strong indoor masking policies. but it's not my choice to decide what your club will do in that regard. So it's up to you to be advocates for your own and your kids' safety. And then, Lewis, you want to answer the second half of that question?
I will, but there's just another medical query which I'll throw to you, and then I'll go back to that. The question is, can the virus get through the mask onto your fingers if you touch the mask, then touch another surface?
Yeah, so when you breathe, the mask is concentrating virus and particles and debris and pollen on the outside. And if you have COVID, it's concentrating on the inside. And so, yeah, the surfaces are not clean and wonderful things. And hence we talk about donning and doffing, right? Putting it on in a way that doesn't get your dirty hands all over the bit that's going to be touching your face, and taking it off in a way that doesn't rub it around and then just get you infected. Now, again, are surfaces the thing that I'm telling you must be like paranoid and frightened about? No. Is there some on the mask? There could be, yes. That is not going to be the vast majority of people's most sizable risk. It's going to be the people that they live and hang out with, hanging out with others, bringing it back and spreading it. And the way you reduce that is to make routine the use of masks when in indoor spaces until COVID is no longer actively spreading in the community or popping up or surging. Like at some point, there'll be a lull, we'll be past the worst of this. Great. We're not at that point yet. So technically, I want to answer your question. Yes, it can concentrate on the outside of a mask, but I don't want to pretend that that is the greatest risk to you getting COVID. It's clearly not. But as much as you can, doff it properly. Don't cross-contaminate yourself, and then move on. Either wash the mask or discard it.
Great. Thanks, Gary. And I guess I just wanted to reinforce a point that you made was, and I had a meeting earlier today about a totally different topic, was culture eats policy for breakfast. And so regardless of what policies you put in place, your club culture, how people act, what people do, is more is stronger and more important than what's written down, so to speak. So I think, as you say, be advocates and set standards, to your points, Gary. I do, again, there were a couple of questions outside my remit, and I'm just wondering, I've got Chris Emmett also on the session, who has been leading a lot of our COVID response in relation to club rooms and clubs and club activities outside of sport and lifestyle. So, Chris, were there any comments based on what you've heard, or a couple of the questions outside of sport that you could touch on?
Hey, Lewis, thanks for
Chris?
handing it over for a sec. No, all good. I guess the main thing is about what I've picked up tonight is about whether to become a vaccinated club or not. So we, Surf Life Saving New Zealand, view each club as their own independent state, or their own, as in health and safety law, as their own PCBU. We've made moves where we are the PCBU, Surf Life Saving New Zealand, or where we'll be affected as a PCBU in and around, for example, beach education, paid lifeguards, etc. So it's up to the clubs to mandate around vaccinations or being a full vaccinated club or not. It's a very personal decision between each club and their members, and there are lots of reasons for that, and I've seen lots of reasons. So my advice would be to work through all the scenarios in your club. There's little matrices you can use, what happens at red, orange, and green's not really relevant in this conversation. The larger clubs will struggle with not being a vaccinated club. The smaller clubs may get away with it. but in a lifeguarding sense, we need to protect our core business, which is lifesaving, and that's our front that we put out to the public too. So that's the one thing that we have really we think tags into the health order. The other part I would talk about is about where to use your My Vaccine Pass and your certified vaccine certificates. So we, on our database, we have most information about most of our members or people that are members. So it was a really easy call for us to say, we will store the certified vaccine certificate information, which is, and really only the stuff we needed was the dates, your name and type of vaccination to add to that, which your My Vaccine Pass doesn't have. So in a sense, life-saving, we can store that information for you. When your administrator is looking at it, it will not have the dates, it will not have the type of vaccination. That stuff gets processed by our administration staff. All it will have whether you're vaccinated or not. So, you know, and then when it comes down to legal requirements, because we're tagged into the health order, we have to keep that information, and we can only store that information legally if we have a purpose for it, and our purpose is basically to run a life-saving service. So that's one thing. The My Vaccine Pass, what I'm starting, there are quite a few questions about scanning in and scanning out of the club multiple occasions. I think you have to work that out as clubs. There are a lot of ways of doing that, and clubs are starting to figure out that. For example, they can most clubs have some kind of member portal or member system that they have within their club, and you can store that on one of those. So, you know, friendly member, etc., etc. There's a whole lot around that. So, yeah, so I see Simon's comments there as well. So yes, the risk assessment and the matrices that we use to determine where members should be vaccinated. But the hard part about that is that, like in most clubs, you have members using all of the areas. So for example, the gear sheds, the bar, the training room, the first aid room, etc., etc. So it's a really tough call. My own club is a Manu. We had a look at a matrix around areas that we thought we could get away with having a hybrid model. At the end of the day, it was too hard. We just have too many members using the club too regularly, or we've become a vaccine-only club at this stage. And there may be some developments on that in the future around the government using different ways. But for now, that was our only option. So, yeah. So that's it for me. Lewis?
Awesome. Thanks, Chris. Thanks for that that input. Wary of people's time, and so I will just wrap up. One last thing was something. So we ran the session last night as well, and very similar themes coming through. One thing that perhaps I didn't touch on at the start that came up last night was parent helpers. A lot of people asked about parent helpers, in particular parent helpers that weren't members of their club. And a couple of things sort of were flagged from that beyond the COVID stuff was one, really encourage all clubs to ensure if people are involved in the delivery of anything, you know, parent helpers generally might sub in as to help a coach if you know someone doesn't turn up, or be a water helper, you know, stand chest deep while kids do a swim, or just be on hand to help those that maybe aren't that confident in the water. Clubs really need to think about their obligations around child protection, and think about if they've got people who are non-members, effectively just parents who their information isn't captured in any way, and those people taking roles in the delivery of junior surf or junior sport. I really encourage clubs to capture their information and get them. I know a lot of clubs, if a kid joins, there's either an automatic or an expected obligation from a parent or a guardian to become a non-patrolling or a social member for that very reason. And it's a great way to grow your club numbers, so that they look great if you're doing applications for grant funding and that sort of thing. But it's also just another way to engage with people who may become lifeguards or may become surf officials and that sort of thing. So getting those people who are involved in the delivery of your programs, I think is imperative from a membership point of view. So that's just one comment on that around parent helpers, aside from the COVID space. Last question there. Will the recording of the Q&A be available for anyone to view at a later date? Yes. So we did one last night and doing one tonight. It is being recorded, and so that'll be downloaded and tidied up a little bit, and then we'll put that on our COVID webpage for people to look at as a resource. So I'd just like to finish up by saying thank you to everyone for giving up your time tonight, but also for your time, be it your first year involved, or no doubt for many of you multiple years involved in surf lifesaving and supporting the movement in your club, and getting, if you're involved in junior surf, getting your kids involved, or if you're involved in sport, getting kids and adults active. So thank you very much for your contributions to the organisation, and thank you to Gary again for sitting through another hour of me talking, as well as the other surf lifesaving staff. I see Luke's jumped on for the second from Southern Region for the second night in a row as well. And Chris for jumping in there with no notice whatsoever. So thank you all again. As I say, we're going to tidy up our advice, give it a bit more detail in those grey areas that people have asked a lot of questions on. And I think the final thing is just do your best. That's all people can ask, is do your best. It's going to be real challenges, in particular for those areas that have moved from level 2 into red and dealing with more restrictions, in particular in clubs or areas where there may be polarizing views around vaccinations and that sort of thing. So just do your best. Surf Lifesaving has a really good reputation with the public, so I think people won't give you too much grief if you're trying to say, hey, we're trying to develop future lifeguards here, just give us some space, sort of thing. So go well. The plan is to, as I say, put out more guidance, but also look to create a feedback opportunity for people to share what they tried, what worked, what didn't, work through how that may work. But again, information will come out from us and be on our website. So thank you all very much. Opportunity now is, I guess, to try and address some of the key questions that have come up, and there are a few. Well, there's one in the chat, but there's also a couple that have sort of been the most regular coming through. So I've already addressed who has to be vaccinated, and the reality is there's no mandate in the junior surfs or sport space, but the reality is there's very few settings where people can be involved where they're not going to be required to be vaccinated. Events versus gatherings. So again, our competitions and carnivals kind of really straddle the two definitions, because our events are run on publicly owned spaces, and our competition and carnivals are somewhat controlled because people pay a fee and are registered. And in terms of gatherings, it's voluntary or not-for-profit sport and recreation, or a gathering to undertake community club activities. So we really do hover between the two of them. And as I said before, there's very little difference between the two other than gatherings allowing you to have multiple. A lot of questions have come in around rookies. Where do they fit, and that sort of thing. Obviously, when we're talking about rookies, we're talking about those people who are above 12, so they're eligible to be vaccinated, but because they're not lifeguards or patrol sport or anything like that, they're not covered by the mandate. However, as part of their training, they may be involved in lifeguarding activities. And so we're just working through what this means and what this looks like for rookies. But again, if those rookies also compete, they're going to need to be vaccinated in order to compete anyway if the competition or carnival requires vaccine certification. Clubs are already doing a really good job of trying to collate and collect the vaccination status of their members. So what we're trying to do is get all that information, uploading that onto our CRM, so that effectively it works a bit like a 200-metre badge or a refresher, where Surf Life Saving New Zealand sees the proof, can tick the box, so that when someone enters, much like if they don't have their refresher, it'll say this person cannot enter this event because they're not refreshed, they don't have their IRB drivers, they don't have their 200-metre badge, whatever it is. In this case, will be they haven't got proof of vaccination. Obviously, there's a lot of technology in behind that, and so what we're trying to get clarity on is there are some legal requirements when getting information for employees and also those people covered by the mandates. And so we're just trying to find out the easiest route for people who aren't covered by mandates. Let's say a coach who's not a lifeguard or a surf official who's not a lifeguard. Can they provide just their vaccine certificate, their My Vaccine Pass to their club, and their club be able to use that as a mechanism to know? Because we're trying to make it as easy as possible so that people can know in advance who, as part of their membership, can take part in events. And the last one that I'll also address is controlling the public. Obviously, the majority of surf lifesaving activities take place in and around beaches, which are public spaces, and aside from putting 10-foot high fences up around all our activities, it's nigh on impossible to control what the public do. Surf lifesaving clubs have obviously a very good recognition within their local communities in terms of the work they do on and off the water, and most people are very respectful of that. All that clubs have to do in terms of trying to control the public is have a clear system and take all steps in relation to providing location QR codes and a process for checking My Vaccine Passes. So examples of those would be in a carnival or competition environment might be barriers or ropes and clear signage to say that this event requires vaccine certification or My Vaccine Pass in order to be part of it. What we're trying, the more things that can be done preemptively, the better to, and all we're trying to do is obviously for clubbies to not get in situations of conflict with either their own members and friends or the public when they're just trying to go about and provide a service to their members as well as the public. I will, what I'll do is I'll address some of the questions in the chat, and also if people do have burning questions that they'd rather speak to or provide more context to, they can put their hand up and I can address those one by one. So the first question from Kate. Yes, so okay, yeah, in terms of privacy and security, yes. So obviously as a member of your club, there are certain information that you hold, and as Surf Life Saving New Zealand that we hold. So, and that's what I was referring to as the two different situations, and why we're trying to gain clarity in terms of my vaccine pass. And based on the information you sent me earlier, Kate, it would suggest that the My Vaccine Pass also has to be secured, stored securely and safeguarded. So that is one that I will follow up for you internally, because that's a little bit outside my remit in terms of Privacy Act and IT security. So I will follow that up. Any from Bass, any view on checking My Vaccine Passes, just citing or using Verify app to have records? So the Verify app doesn't store information. It's purely a bit like when you go to catch a plane these days and you scan your QR code. It doesn't store any information on the person's phone who is verifying. It is purely just a tick or a cross situation. So that can be done, I guess, in the same way as viewing. I know there was a little bit of a conjecture about this between politicians as to what was able and what not. In the information that has come out most recently, it is clear that for gatherings, that it is the person responsible for organising the gathering to verify the person's vaccination status. Feel free to put your hand up in the Bass if that hasn't answered that correctly, and we'll circle back around. There was a comment in the FAQ that junior surf corners can access the vaccine and find out. Can we get notes about how to access this? Are you talking about this now? Yes. Yes. So assuming that we can, we pass the legal and privacy requirements, it is really, again, no different, although it is a medical record. So it is a little bit different to say junior surf coordinators being able to see who's got their 200-metre badge and who doesn't have their 200-metre badge. That would be the ideal situation for clubs, no doubt. But again, we just have to check that the privacy information, or what we're storing and what is available to others, isn't in breach of Privacy Act. Can you please confirm the date that volunteer guards, clubbies, athletes older than the position would be expected to be verified? So the vaccination mandates that came out for volunteer positions, so that's guards, that's patrol support, and beach head, is the 1st of January. So the 1st of January is the day for those volunteer positions. As I say, there's no mandate for clubbies, general club members who aren't in those positions. Excuse me. Yes, but obviously, if there is a competition on Sunday and someone isn't vaccinated, and the competition organisers determine that they will implement vaccine certificates, if you cannot verify your vaccination status, you won't be able to take part in that. Okay, and I've just realised I had my camera off the whole time, so apologies for you guys staring at a blank screen while I've been talking monotonously for the last half hour. Do clubs enter officials' MVP info, and how do event referees get to know who isn't clear to officiate? Good question, Bruce. So this is one of those little grey areas that sits between both Surf Life Saving and clubs. So when we run events, often it's a combined effort between clubs putting their volunteers forward, and the event manager also and the event referee working together to, if there aren't enough, or if there aren't enough experienced people to do particular roles, they may pull in others. So it's a little bit of a combined effort. As club members, the preference for us is for first of all the individual to supply that information, because at the moment the Surf Life Saving New Zealand is are the ones who are ticking the box, so to speak, on the New Zealand database. And so it is for the individual to provide to Surf Life Saving New Zealand, but I know clubs are also doing the rounds to try and get that information in bulk to provide to us as well. So I would certainly advocate for clubs to support their surf officials to get that information as well. And so it'll be, to answer that question, Bruce, it will be the role of the event manager and event manager to ensure all those people are vaccinated should the event that they're running require vaccine passes. Cool. Another. Cool. And SLS NZ sign-in app for junior surf sessions carnivals would be a game changer in general, regardless of COVID settings. Good question, Jason. And yeah, funnily enough, that is under development, or has been, and we actually had to put that on pause in order to address the COVID issues. But that is certainly something that we have underway to provide a nice and easy digital sign-in scenario with junior surf and with carnivals, and we already have it through our Enter Now, but certainly we're looking to extend that to potentially all Surf Life Saving New Zealand activities, where if you're running a coaching session, if you're running a examination, anything like that, that it can be done via an app. Okay, with junior surf, we rely on parents to help with our junior surf age groups. What are your thoughts on asking those parents vaccination status, or do we run our junior surf based on non-vaccinated numbers and separate our groups? So, yeah, two things on this, and that's come up a lot in our frequently asked questions around is, parent helpers. The first thing I'll say is I really encourage clubs to try and capture as many parent helpers as members. Some clubs automatically, when a child signs up as a junior member, requires a parent to sign up as well as a social member or as a non-patrolling member. And so that means that, one, you grow your membership, so your numbers look good, but also you have that information on your database as well. So that aside, ultimately anyone involved in the delivery of sport or junior surf, whether they're a member or not, because we know there are lots of non-members who do help, if your club decides to implement proof of vaccination, then those people will be required to show proof of vaccination. And as you point out, yes, you do have the option to split up your numbers and do multiple gatherings to, if you want to stay in a non-vaccinated situation, but obviously your numbers are going to be significantly limited compared to if it was vaccinated. And then the flow-on effects of that in terms of if children and parents want to then be involved in large-scale carnivals and that sort of thing, that will be requiring them purely because of their size. Shannon from Karitahi. Junior surf and red light, no vaccination certificates equals a number cap of 25, but our juniors are under 12, so can't be vaccinated. Do we have to limit our junior surf? Yes, so regardless of vaccination status or not, and for the under 12s, the number limit is 25. So for Northern Region clubs who are currently running junior surf, and they have, let's say they've got 100 10-year-olds, they're splitting those up into 4 groups of 25, or actually 5 groups of 20, because then they include the water safety and the coaches in that. That's the current system until Friday. One of the significant changes in that is those delivering will be excluded. So you could have a group of 25 kids, and you could have 1 coach and 4 water safety, and that is your separate bubble. Sorry, I can't use the word bubble. Gathering of 25, and you could have 4 of those spread out along the beach, completely separated. But obviously, you need to ensure that they're well separated, and then if you've got parents watching and that sort of thing, they need to be separated as well. Can a club transition between needing vaccination certificates and not? Yes. So effectively, in this scenario, when activities are like one after another, you can run one as a non something not requiring a vaccination certificate, and the next one is requiring. And the guidance is to ensure that both time and cleaning takes place between the two, so there's no intermingling. What won't work is if you have multiple activities or gatherings in the same space at the same time. It's either one or the other. So you couldn't have, say, a junior surf, have one group of junior surf kids over here of 25 and are unvaccinated, and another group over here of 100 that are vaccinated. And I think also we need to take into account the look and feel of what that means for both groups. Emily, with regards to volunteer parent help, I appreciate they don't have to be vaccinated under mandate, but if they are on the beach and therefore part of the junior surf numbers under orange, wouldn't think need to have a vaccine pass anyway, or only if the club chooses to require passes, or is this part of the government mandate? Correct. So the only way you can have unlimited numbers is by implementing proof of vaccinations. And so by implementing proof of vaccinations to gain that unlimited number under orange, the club, the organizer, is saying we will put clear systems and processes in place to check the vaccination status of people. And so this means you can't sort of say you're going to be be a vaccinated kind of gathering or activity, but then do nothing about it and just assume everyone's vaccinated. There's got to be processes in place to ensure that occurs. And obviously each club is going to have their own context as to how that might occur, depending on their space and depending on their numbers. The potentially easiest way to do that, if you had a group of under 10, so the kids don't need vaccine passes, they're fine, is that parents come along and a coach or manager verifies them all. That will probably be the case for the first couple of weeks, where you'll need person-to-person verification. As our technology and our collection of member and non-member information, member information increases, effectively clubs will have the ability to go, okay, these are all the people that are vaccinated, so we don't even have to worry about them. They're ticked off, all our coaches, they're done, all our water safety, they're done. Then you get that grey area of parent helpers. As I said again, I'd really encourage clubs to try and capture their parent helpers in some form or another. Because they're dealing with children in your club under 18, you should have a really clear idea of who is engaging in that, purely from a child safety perspective and a child protection point of view. And so that probably opens up a little bit of a can of worms for clubs. But ultimately, to answer that question, Emily, is if you want to operate to be vaccinated, you have to have a system in order to check. Ken, for junior surf parents and helpers on Sundays who are vaccinated, how do you scan their passes? Is there an app? Yes, there's a thing called a Verify app by the Ministry of Health. Super easy to download, super quick. It doesn't store any information. It just gives you a green light or a red light situation. You only need internet or data to download it. Once you have downloaded the app, you don't need internet to scan people's QR code. Can we use our boards and other gear under the light system? Yes, yep. So one of the things that's been removed has been around the kind of sharing and sanitizing of equipment. It's still best practice, but it's not specifically stipulated under the COVID protection framework. And so, yes, you can use boards. Assuming that you're probably from Northern Region, or a Northern Region club, one of the limitations around the use of boards was because under alert level 3, step 2, which Auckland is currently under until Friday, was access to clubs was only for essential purposes. And so clubs were making the decision to not allow access into their club rooms and gear storage sheds for that reason. So there was no guideline or anything to stop people using boards, but it became a practicality piece for clubs to monitor access to the club rooms themselves. As New Zealand surf clubs are affiliated with Surf Life New Zealand, does this mean that Club Junior Surf is effectively the Surf Life Saving New Zealand event and indirectly organised by Surf Life Saving New Zealand, meaning junior surf gatherings need proof as opposed to strongly recommended? Oh, Mark, yep, that's a little bit outside of my remit in terms of governance and control. Ultimately, all sports clubs are effectively, or community clubs are effectively independently constituted bodies, and so can make and drive decisions for the needs for their community. So Surf Life Saving New Zealand Inc. as such doesn't directly deliver junior surf in the club environment, and so it still is a club situation. It would be great if it was that easy, where we could just say mandated as opposed to strongly recommended, but it's not something we can do, I'm afraid. Radley's question, yeah, preference will be for parents and athletes to register passes with the club, so that volunteers do not need to request passes on the beach. That would be absolutely preference in what we're working to, because it would greatly reduce the potential for conflict on the beach, and we don't want to put anyone in that situation, especially with their own community and club members. Again, though, the government order very clearly stipulates that if you are going to run a gathering, organise a gathering on an event that requires vaccine passes, you have to have a system in place to check. Now, that system could be pre-checking, and that system could be on the day checking, but it's we're working as quickly as we can to try and ensure that both options are available. Emily's, so if they're unvaccinated, they can still participate. We just need to have it recorded within the passes. No. So let me be clear. Unvaccinated people can participate in say junior surf, or a club sport event if that club, the organizer, determines that they are going to run an event that does not require vaccination passes, effectively meaning it's open to those who are vaccinated, those who are unvaccinated. However, the numbers who can be involved in those gatherings are obviously very strictly limited. Whilst if you made that decision, you wouldn't require vaccine passes, you would still require everyone to scan in their location. Pass verify link above. Oh, okay. I've been told I have a very monotonous voice, so if anyone was tired, hope I haven't put you to sleep. Well, you could just turn on the microphone for the kids, and I can slowly put them to sleep. I don't have any hands up or anything else. What I do have is, oh, I do have a hand up. I'll just go to that. Sorry. Is that Medahini?
Yes, kia ora. Yeah. I just wanted to know, we run a surf club that's in Orange, will be in Orange on Friday. Mm-hmm. We come from a red light area. Does that have any implications?
No, so people can travel freely between areas unless you're from Auckland, and only on December 15, Auckland is allowed to go past their borders, and in order to go past their borders, they need to, I think, have a negative test and or have proof of vaccination. So if you're in outside of Auckland and you're in a red area and your local club is in an orange area, you can travel freely, and it has no impact whatsoever.
Perfect, thank you.
Just a question there from Chaz in regards to parents spectating junior surf, so not helping. How far away do they need to be before they need to be checked? So I'm working on the premise that this particular context is that the club is running is requiring vaccine passes to be checked to participate, or from a parent perspective help. And that you've got, so let's say they're on the sand, and then you've got a whole lot of parents up on the bank. Effectively, the deal with gatherings is you can have multiple separated gatherings in separate defined spaces. So separated means by 2 meters or more. So if you've got kids down on the beach and 5 parents helping them out, so to speak, and you've got parents 10 meters away up on the bank having a yarn and a sunbathe while the kids do junior surf, absolutely no requirement to start walking the beach to scan other people, and those people are not part of the gathering that you have organised. You have organised a junior surf gathering, and it is in this space. Those people are not part of it. If those people, as we know, parents kind of crowd around and have a look at how their kids are going or whatever it may be, and I think that's around that preemptive communication to your members and to your parents to say, this is, and we've seen some really awesome examples of it in level 2, people doing beach maps and splitting up their age groups and that kind of stuff, just to make it really clear. So again, I think it's just making it really clear that, say, as a club, our junior surf is going to require vaccine certification. This is how we're going to check it, and if you are in this area, we are not going to check your vaccination status because you're not part of that gathering, so to speak. Phil, probably a time to remind me that if you are limiting your unvaccinated, you don't have a heap of under 12 kids turning up without a parent and creating issues around your required ratios. Yes, yeah, that obviously, if you're needing water safety and that sort of thing, it is going to limit your numbers. I will try and here we go. So there is a hand up, but there's a lot of people on this call, so my computer is lagging a little bit. Catherine, fire away.
Hi. Yeah, just a question around whether there's a sort of a grace period for children who become eligible for vaccination, i.e. turn 12 during season. Is there a date, or is it like a 3-month period, or is there any sort of, if the club is going down that line of a vaccine mandate, when are we expecting our newly turned 12-year-olds to be compliant?
Sure. So the government and Sport New Zealand information is effectively children aged 12 years and 3 months are effectively exempt from requiring vaccination or providing a vaccine certificate. So effectively, from the day a kid turns 12, they've got 3 months to get double vaccinated before it will have any impact on their involvement. So effectively, it's quite a small group when we look at our situation, is that effectively everyone in the under 12 age group was 11 on the 30th of September. And so a whole heap of kids could have turned 12 since October 1. And totally understand, more so for children, there may be hesitancy from both child and parent and that sort of thing. And so Surf Life Saving New Zealanders, we don't have any expectation, and in our events we won't be scanning or checking scanning for anyone in the under 12 age group, because effectively it won't be until February, October, November, December, it won't until January, February that those kids will be 12 years and 3 months. So there is a grace period there. It'll only be those kids who are very young 12-year-olds in the under 13 age bracket that would be affected. And again, that's kind of only kids who are born in kind of that August, September age group anyway. But again, they're already 12, so they would have had a decent amount of time. Hopefully that answers your question.
Yeah.
I'll just switch back over to the chat because another question has come in. If we choose not to check vaccines but are working within the number limits of the traffic light system, if there's an outbreak at our club gathering, could there be a health and safety liability for us choosing not to check vaccines? Right. So you're effectively Tom, what I'm taking from this is effectively saying is that you're working within the limits. So Sumner, you're in orange, and so your group sizes are limited to 50 if you're not going to implement checking. So you're working within the limits, great. And there's an outbreak at our club gathering. Could there be a health and safety liability for us choosing not to check? No, you're working within the guidelines. The guidelines are groups of 50 or less if you're not implementing vaccine certificates. And so there isn't necessarily anything illegal or outside a health and safety liability, just the same as if 400 people go for a walk on the beach, sort of thing. But I would, I guess, look through a lens of organisational, reputational risk in terms of that. Obviously, being vaccinated doesn't necessarily determine whether or not someone has COVID or not, but it certainly does reduce the risk of that. Okay, 5 minutes left in our scheduled time. Okay, just with 5 minutes left, I'm just wondering, are there any other, I know Gary's been on the whole time, but any other, and I'm not trying to steal any limelight in anything, Gary or any other Surf Life Saving New Zealand staff that wanted to outline any key points that haven't been covered or clarify anything? Dr. Gary?
Sorry, Lewis. Yeah, sorry, Lewis. 1 second. I'm just setting something up here. All right. Hopefully I've got some video on and some audio going. I didn't want to say too much, but I did want to say a little bit. And that's just every parent's worry is about their kid potentially getting COVID or spreading it to older family members, that sort of thing. So I wanted to just repeat some themes that I think are relevant. So my name is Gary Panda. I'm the medical director for Surf Life Saving. Some of you might not know me. I'm also an emergency doctor at Whangarei Hospital and rescue helicopter doctor on the Westpac helicopter. And what I want to say about risk in COVID is that risk is really mitigated by being outside. And so COVID is largely a disease of densely populated, poorly ventilated indoor spaces, especially with prolonged exposure. So the greatest exposure to any of us, even me working as an emergency doctor, doesn't come from my patients. It comes from my home environment and my family and friends, the people that I spend a lot of time indoors with. We're breathing the same air, and that's your risk factor for COVID spread. It's not really about surface transmission. It's not really about hand washing. I mean, these are all good things, but their actual import is quite small. It is about avoiding any unnecessary, prolonged indoor close contact exposures with others. So if you have to be indoors, you wear a mask. That's beyond clear. The more people that do that, obviously masks prevent COVID coming out of a person as well as COVID going into the next one. So having many people wear masks indoors really makes things safer for everyone, markedly safer. Likewise, obviously, being double vaccinated, having your boosters also reduces your risk of hospitalization by 90%, reduces your risk of death by about 90%, and it reduces your risk of transmission to others by at least a half. Numbers vary a bit, but it's significantly better to be around vaccinated people than unvaccinated. You're shedding for far longer when you're unvaccinated, or obviously exposing yourself to unvaccinated people. So my advice is really a lot to do with vaccination, mask wearing, and doing things outdoors when you can. So whenever you can, if you can have a training session, a resuscitation of a first aid patient, whatever the case may be, if you're doing it outside, keep it outdoors. I want you to be sun protected while you do that. So do it under a shade sail, do it under a roof line of a porch, but avoid unnecessary indoor exposures. If there's no choice due to weather, temperature, whatever, you have to be inside, fine. Mitigate that risk. Open up windows, open up doors, allow great through ventilation. If you also have people masking up indoors, fantastic. People often ask about masking outdoors. I think if you're going to be close, less than sort of 2 meter exposures for and or for a prolonged time, it would be quite prudent to wear a mask in those situations as well. But I think overall your risk in an outdoor training type of scenario is trivial. And where we've seen harm and risk is when people, it's not when they gather outside for their sport or in their stadium for their, FIFA soccer game or NFL football game by the tens of thousands. It's when they go indoors to party, drink, socialize, and hang out. So those are the high risk period is not going to be the stuff you do out on the beach at all. It's going to be the stuff you do in the clubhouse when you're just hanging out and having a good time. So that, I guess, is a short version of my advice for how I would keep my kids safe and how I conceive of risk. I'm happy to take some questions if Lewis wants me to, or I'm happy to just leave it there. And wish you all a good season.
Question from Josh: will the full Q&A be posted on Facebook? Yeah, we'll work through the technicalities of downloading this and trimming it and making sure the sound quality's good for everyone. And we'll also I've got a track of the questions asked, and we'll be able to add that to our Q&A. So I did just want to remind everyone who wasn't on to start with. We have our I'll just quickly share my screen. We have our COVID-19 information webpage here, and it's got everything for clubs, lifeguarding, and sport down here. And also, so on the sport one, if you click on that, it's got the information that went out today. I'll be updating that, and at the bottom of this very long memo was a whole lot of Q&A. stuff. What we've done is we've just added that to our webpage to cover everything. Gives us the ability to add to it and adapt it or change it if required, because obviously as soon as something's in a document, it ages. So I can stop presenting now. So yeah, if there are no other questions or queries, I really just wanted to finish by really acknowledging and thanking the regional sport managers, the CDOs who have helped put this information together, and not just about tonight, but for about the last 4 months dealing with this, and the clubs in terms of trying to work as best they can with best intentions to keep their members and keep the public safe while still engaging their club members, and in this particular context, their juniors and the people who are keen for sport. Some regions have been really lucky and had lots of events. Other regions have had none. And so I know there's a whole lot of people really looking forward to getting to the other side of January and engaging kids in junior surf and getting back into the ocean and getting along to some competitions and carnivals. So I really want to thank all of you who are involved in helping that occur. Obviously, things are going to change into this COVID protection framework on Friday or midnight Thursday. And so things are going to be different this weekend for people to what they've done for the last few weekends. Possibly not those in the Northern region because they've been under stricter limits. Just do your best. Try and keep it cool and focus on just trying to do what you can with the resources and space you've got. Feel free to, after this meeting or after the weekend, email with any further clarifications you need, saying, hey, we tried this and this worked really well. Everyone's trying to solve the same problem. So rather than 75 clubs do it by themselves, we can work together. So feel free to put that information through to me, and I'll keep updating the information on our webpage. Other than that, thank you all for your time tonight, and yeah, good luck over this weekend and coming rest of the season. Thank you, everyone.